critical review paper presentation. I did emotional disorders as my topic. Okay, so this is my abstract. Basically, you can read it, but all it says is that emotional disorders can be really confusing. They're a little bit hard to understand at first, but once you research them and go into all the different types and symptoms and treatments and all that kind of stuff, they're not that hard to understand, especially once you realize that you know people that have emotional disorders. Because once I actually started going through this, I realized that I do know people that could possibly have the disorder and all that kind of stuff. Okay, so here's the first page. And I just start off by defining what a emotional disorder is by Webster's Dictionary. And that is any mental disorder not caused by detectable organic abnormalities of the brain and in which a major disturbance of emotions is predominant. I know that is pretty hard to understand just like off the bat, but basically an emotional disorder is linked to emotional complications experienced by children as well as adults. It can be hard sometimes to distinguish an emotional disorder itself from just a kid that has bad behavior. So, a teacher or a parent or whoever thinks the kid might have an emotional disorder has to monitor their behaviors on a consistent basis to find out whether or not it's an actual emotional disorder or if it's just a behavior problem. But a person is said to have a particular emotional disorder when their behaviors are stark, and occur regularly. So if it's something that happens all the time, and it's like a regular, basis type thing, then it probably is the emotional disorder. But if it's just here and there and it's not like an all the time thing, it's probably just a behavior issue. So if anyone does have questions whether or not it is an emotional disorder, they're not sure if it's a disorder or if the kid just has behavioral problems, there are always experts that you can ask about it, which I would highly recommend. So there are four types of emotional disorders, like four main types, and that's anxiety disorders, depressive disorders, behavioral disorders, and personality disorders. And inside each of those four types, there are also specific diagnoses. So, like if someone has an anxiety disorder, that could break down to them having a panic disorder, panic anxiety syndrome, OCD, which you guys mostly know is obsessive compulsive disorder, post traumatic stress disorder, basically any kind of anxiety or stress disorder, and even phobias would be considered an anxiety disorder. So then that takes us into behavioral disorders. And that is the kind of stuff like depression, bipolar disorder, ADHD, autism, anorexia, Tourette's, all that kind of stuff, where it actually affects their behavior. That's why it's called behavioral disorders, of course. So then personality disorders can be anything like, actual borderline personality disorder, multiple personality disorders, avoidant personality disorders, um, all that kind of stuff. Let me see here. So yeah, all that kind of stuff goes with the personality disorders. And there are, like I said, more than that. Those are just a few that I decided to name. So like I said before, it can be hard to separate like an actual disorder from just behavioral disorders that kids are having. But there are definitely types of indicators that you can see that could show you that a kid does have a emotional disorder. So like in a classroom setting, it would be things like getting out of their seats constantly, yelling, talking out, cursing, disturbing people around them, hitting people, ignoring the teacher when they try to talk to them, complaining excessively, always trying to argue with someone, stealing things, lying, destroying other students' property, not following directions, temper tantrums, and also a lot of kids that have emotional disorders will exclude themselves from anything. Like if the teacher wants to do a group experiment, even when they're playing outside at recess, all that kind of stuff, they want to exclude themselves from it because they don't feel like they can interact with other students the way that they should be. So for an example of a kid that would have a disorder, that is exhibiting these behaviors. If a kid had ADHD, they would be yelling, talking out of their seat, disturbing people around them, all that kind of stuff. When in contrast, a person who has bipolar disorder would be the one who is excessively arguing, maybe having temper tantrums, and even wanting to exclude themselves from the other children. So the different types of disorders can be broken up into 3 groups, and these are externalizing behaviors, internalizing behaviors, and low incidence behaviors. Externalizing behaviors are the style that's more violent and forced and disobedient, like ADHD, where the kid is, like I said before, trying to get out of their seat and constantly yelling, can't really sit still, that type of thing. Internalizing behaviors are more of a reserved type, where they're more withdrawn, they feel lonely, they're depressed, they don't feel good enough, such as anorexia, where it's an eating disorder where teenagers or adults or even children don't eat because they want typically that attention because they feel lonely and withdrawn from everyone else. And low incidence disorders are the rarest of all 3 of them, but they can be really serious. This is more of a disorder like schizophrenia. I know we did a lot of studies and we had a lot of videos on schizophrenia, so you guys know how it typically works. But that is more of a low incidence disorder, and it seems to be the most serious out of all of them. So with that, they show a pattern of disconnectedness, poor social modification, all that type of thing. Yeah, so then I go into talking about how you can interact with the people and how interactions with them can actually even like bring different outcomes between being able to them to be able to perform well in the future and them not being able to perform well because they haven't had good interactions with people. So we take a person who, for example, take a person who has this type of disorder and their parents don't care, any type of emotional disorder, and their parents don't really want to diagnose it or don't really want to label them, as they would say, so they don't get them treated, they don't give them medication, which certain ones can have medical treatments, they don't pay any attention to it, they just let the child struggle with all the different emotional problems that they're having. And typically, a child like that will grow up to feel unwanted and unloved, and they feel like they can't get a hold of their problems, and so that puts them into a depression. And a lot of these kids go on to commit like criminal acts and stuff like that, and then they end up in prison and places like that because they don't feel like they can move on and be a normal person in their life because they have this thing that's holding them back that no one has ever helped them with their whole life. And then you have a situation where a kid has maybe the same type of emotional disorder or maybe a different one, and they get help. Their teacher has a meeting with their parents and wants to help them out, so they get the kid diagnosed. Maybe they get him on some type of medical treatment. Maybe they just take him to therapy. And this kid ends up growing up to have a great job, being able to interact with people because they were treated for their disorder and they were able to learn how to interact with people. And they can lead a fairly normal life with this disorder because it was treated the correct way and properly. And that was shown in several studies that people did. If want to look into that or whatever. But that is a really important thing, is to properly diagnose a kid and all that kind of stuff. So there are several different treatments. This is the last thing, for emotional disorders. And there are psychosocial medications, cognitive behavioral therapy, family psychoeducation, social skills training, all that different kind of stuff. Sometimes, and most often, doctors will recommend a mix of psychosocial medications as well as as pharmaceutical medications. So that just means that the kid, would be put into therapy or something like that, as well as taking pharmaceutical medications, which that tends to be the most effective if your disorder complies with that sort of thing. So although emotional disorders are a very unfortunate thing, by handling the situation correctly, you're giving the individual student or person a way to overcome it by helping them do these things. And if you just kind of let it go and don't really get them any help, it could be a much worse situation than it needs to be. So here's the reference list. I had the citations in the paper as well. Um, so yeah, that is basically my entire presentation and my paper. Thanks for listening.